Thank you everyone for making time this evening to be with us. My name is Kimberly Buckingham. I'm the manager of the ThriveKids program here at Children's Hospital New Orleans. Our town hall this evening is meant for the parent audience, all of you that take care of our kiddos that we see here every day. And we appreciate you making some time to talk about COVID-19 with us. So we've dedicated the hour to just providing a little bit of background about our program and some of our partners. And then we'll run directly into an update on COVID-19 in Louisiana as it stands today, and some of the golden rules and fundamentals to keep in mind, especially as we enter into the holidays. And then we'll jump into our school decision trees and some resources we have to support you. We have had several questions come in beforehand that we'd like to review today. I will open up the chat that you can send a question directly to me. If we have time, we can incorporate that into our discussion. So thanks again. All right, so just a little bit of background about ThriveKids here at Children's Hospital New Orleans. This is a new program we've launched recently that does build on the foundation of school-based programs we've had here at Children's Hospital. The goal of this program is to bring medical care and medical guidance into the school environment to support students and all of those who care for them. A big piece of our program has been COVID-19 support. Starting this summer, right after the pandemic hit Louisiana, we did partner with the Department of Education and as well as NOLA Public Schools to be a medical consultant as they brought students and staff safely back to campus. So our medical services have been supporting over 3,000 public educational institutions statewide, as well as several independent educational institutions from daycare centers to private schools, charter schools, etc. So it's been a wonderful partnership to work with schools during this pandemic, and we appreciate everything that families are doing to make that process a reality and successful. I'd also like to give us about a minute to review a program that's underneath our ThriveKids umbrella. That's the Parenting Center. We're putting this event on tonight in partnership with this department. We have the manager of the Parenting Center here tonight, Ms. Patrice Wright. So I'll turn it over to her for about a minute just to explain what they do, as well as how you can follow up with them after our conversation this evening for additional resources.
Thank you, Kimberly. Good evening, everyone. I appreciate you guys being here with us tonight. Again, as Kimberly mentioned, I am Patrice Wright. I am one of the managers or co-manager at the Parenting Center. The Parenting Center is simply a department of Children's Hospital that helps parents and grandparents with the ordinary challenges of raising children from birth through adolescence. So tonight, I know our focus is all about COVID, but I want you guys to know that in the midst of COVID, there are still also other parental concerns that may come up. So at the center, we serve as a resource center where parents can learn about development and parenting strategies, a support center where parents can discuss concerns with other parents and staff, and a referral center as well. We are available between 9 and 4:30 every day to answer questions. Parents may have questions regarding sleeping habits, toilet training, how to keep their kids on schedule, so forth and so on. So we talk to parents of children ages birth all the way through 17 years old. So here are ways that we are able to assist our families or families within the communities. We have parent educators that are available by phone at the number you see listed there. So now might be a good time for you to take a screenshot if you possibly can. I'm sorry, we're on a webinar, but if you are able to see the information, you can simply take our phone number down, which is 896-9591, or email us to talk about the parenting questions and challenges you're having, like eating and sleeping, so forth and so on. We also offer some free classes virtually. Every Monday, we have music with Miss Erin at 10 a.m. We have a couple of new parent support groups, one on Tuesday, also one on Friday for breast and bottle. And we also have a parents hour every Wednesday where we talk to parents about any and all things. Again, Patrice, thank you for the opportunity, Kimberly. Excited to be partnering with ThriveKids, and the Parenting Center is here for you guys if you need us. Have a great evening.
Thank you, Patrice. I know that you all have been guiding lights for parents with teaching at home and doing virtual learning, so everyone please feel free to reach out to that. Okay, so jumping into our COVID-19 guidance, We do have our lead COVID-19 expert here, part of our webinar this evening. This is Dr. Lee Reinfection. He's our Chief Quality Officer for the organization, and he's also led our COVID-19 response as a whole. So thank you, Dr. Finger, for making time tonight, and I'll let you have the floor to do your update on COVID-19 and some of the fundamentals that come with it.
Sure. So thank you, Kimberly. Thank you, Patrice. I appreciate all the parents and guardians and grandparents who have joined us tonight to learn a little bit about where we are 280 days into our local COVID-19 pandemic here in New Orleans and Louisiana. As we all know, Louisiana and New Orleans is entering the third quote-unquote surge of this disease since it struck locally back in March, meaning we have rising case counts. And although our local hospitals aren't as stressed as we were back at the end of March, we are starting to see stressors across the state. It's a slightly different age population that's being affected right now with this disease, as opposed to the where early on when it was really elderly above the age of 65 years who were struck very hard with this disease. These are the golden rules, which I've sort of, presented to schools and educational leaders and our hospital team members since the beginning of this pandemic. There are simple things that we can do to keep each other and ourselves safe. The first thing is washing your hands. The second is truly wearing that mask anytime you go out in public, and or specifically if you're in an indoor environment. Third, socially distance at least when you can, as much as possible. And although it's number 4, perhaps the most important, staying home if you're sick. I think as I've talked to students and families and school leaders, whether they're principal or the leader of our state Department of Education, the most important thing that people can do to help mitigate the spread of this disease is staying home if you're sick. And I think early on, there were lots of people who didn't understand the magnitude of this disease. And even when they felt slightly bad, whereas before March of 2020, it would be something you take some Tylenol or Motrin and push through it. We really can't encourage or embrace that, because even mild symptoms could be consistent with COVID-19. So we really preach this, and I think families of students have embraced this. Our educators teams now understand this, that it's not worth it to go to school if you're feeling a little bit off. It's really worth it to stay home and really protect not just yourself, but everyone else around you. By and large, schools, as far as I'm concerned, are one of the safest places for our children to be. I know I have 3 daughters in New Orleans public schools, and I'm fully confident that the school system is one of the safest places for them to be. The operational improvements that schools across the entire state, with the leadership of the Department of Education's Return to School Safely plan, New Orleans Public Schools, and our partnership with lots of independent schools and school districts across the entire state, really are beyond reproach. Although we have seen cases where either children or team members have COVID-19, the quarantine efforts that our schools are doing and following up with really have been impressive, and there's not been a ton of spread of this disease on school campuses. We have seen children catch this disease, but frequently it's when teenagers are gathering together off campus when they're not under the watchful eyes of either their parents, other family members, or teachers, and not respecting the social distancing or mask wearing that we're trying to get them to embrace. So by and large, I've been very, very impressed and happy with how this academic semester has gone. When we started working on this way back in May and early June, how to keep our kids and our educational team members safe. It's not over yet, but we'll get to talking about the arrival of a vaccine, and I'm optimistic that 2021 will be exponentially better than 2020 has been. I'd like to take us through sort of a slide where we talk about how schools have operated and made decisions when there are symptomatic students or team members on their campus. This is a decision tree that we supply to the Department of Education. and I'll just take you through it, broadly speaking. Many of you are probably well aware of this just from the last 9 months, but essentially this is how we encourage schools to act, sort of translating all the information into an easy to follow algorithm. If someone has illness at school where there are symptoms that can be consistent with COVID-19, which essentially can be anything, that student or team member should be removed from exposure to other people immediately. And either their choice is to either get a COVID-19 test or get evaluated by a healthcare provider. And again, the capacity of local testing is different. Here in New Orleans in Region 1, we have relatively good access to COVID-19 tests with relatively rapid turnaround times. It's much better in the rest of the state than it used to be, but it might not be exactly as good as it is here. If someone chooses to get a COVID-19 test and that test is negative, they are instructed to stay home until they have symptoms improve and they're fever-free without medication for 24 hours. Essentially what they should have been doing before March of 2020. If that COVID test is positive, and that can be either a molecular test or an antigen test, then that means they have COVID-19 disease and they need to isolate, which means they stay at home, ideally separate from the rest of the family as much as possible until it's been 10 days since they had their first symptom appear, or if they were asymptomatic, the date that they had their positive test done, and their symptoms have improved, and they've been fever-free without medication for 24 hours. Some symptoms persist for weeks to months, including loss of taste and smell. So we don't require that that has complete resolution before that individual is able to be removed from isolation. If, going back up to the middle of the algorithm, instead of choosing to get a COVID-19 test, they choose to get evaluated by their primary care provider, they might be given an alternate diagnosis by that provider and determines that a COVID-19 test is not indicated. If that's the case, they still need to stay home until their symptoms have improved and they're fever-free without medication for 24 hours, or their provider might advise them to get a COVID-19 test, at which point they would follow the algorithm that I previously reviewed. I will tell you that here in New Orleans, with easy access to COVID-19 tests, I have strongly recommended that even for mild symptoms, a COVID-19 test should be obtained. It is nearly impossible for me to determine when a child with a mild runny nose has COVID-19 and when they have allergies. I've been fooled many, many times before. Kimberly, why don't we go on to the close contact guide? So to review, a close contact is someone who has been within 6 feet of someone who tested positive for COVID-19 for a total of 15 minutes or more over a 24-hour period. And it doesn't matter if the person with COVID-19 or if the other person has a mask. That exposure needs to take place within 2 days of the positive person's onset of symptoms or the positive test result, whichever came first. As an example, if I on Monday get a fever and a cough and I go and get tested on Tuesday and it's positive, I would look back 2 days before I developed those symptoms. So anyone who was around me and deemed as a close contact on Saturday, Sunday, or Monday until I started isolating from people would be counted as a close contact. Go back and look 2 days. The reason we use 2 days and not 48 hours is that many kids are unable to precisely tell us when exactly during the day they develop symptoms, so we just look back a full 2 days. So let's say you're determined to be a close contact, you quarantine, and essentially what that means is you go home, you stay at home, and you make every effort to not go out to general public as much as possible unless it's an emergency. Until last week, the gold standard for quarantine was that you stayed in quarantine for a full 14 days after your last contact with the positive COVID-19 individual. Last week, the CDC announced some guidelines with options to decrease that 14-day quarantine, and I'll describe those as follows. If you are still symptom-free after 10 days in quarantine, you can reduce the length of quarantine from 14 to 10 days. That does not completely eliminate the risk that the individual who was a close contact won't get COVID-19, but we're quite comfortable that the vast majority of those people will not develop COVID-19, but they still need to carefully monitor themselves for symptoms for that last 4 days. And if they do develop any symptoms, they should immediately self-isolate, and it's strongly recommended that they get a COVID-19 test. If local testing options exist and you can get a COVID-19 test between days 5 and 7 of your close contact, and we are only recommending that that occur on day 7, you can do that. If that test is negative, they can end their quarantine and potentially return to school after 7 days. If that test is positive, you obviously follow the symptomatic decision tree and remain in isolation from the day that your test is obtained. Again, to reiterate, we have said that these are potential possibilities for school systems and local schools to adopt, but they certainly don't have to. I know that New Orleans public schools are sticking to the previous quarantine period for the duration of this academic semester, meaning that close contacts are on quarantine from school for 14 days from the last known day of close contact. Many schools that I've spoken with have chosen to adopt the 10-day rule because it's too complex for them to navigate the testing and verify and validation of that test for their students between days 5 and 7, and to juggle some students who are able to get the test and others who aren't, and then have a mix of hybrid population already challenging to manage as it exists now. One last point I'll point out is that if there's a family member who tests positive in the house, they need to isolate, which means really removing themselves as much as possible from exposure to other individuals in the house. It would be ideal if that person could have their own bedroom and bathroom and sort of have food delivered to them so that there's really no exposure to other family members in the house. That's not possible everywhere. So in families where complete isolation isn't possible, we would ask that the person who is positive wear a mask when they have to use common areas in the house and try and maintain social distancing from everyone else and use good hand hygiene. It would be great if the other families could also wear a mask, especially when that positive family member was in the same room. That being said, if someone can't effectively isolate, a close contacts quarantine period will only begin after the positive person's isolation period is over. Meaning, if I get COVID-19 on a Monday and I can't effectively isolate from the rest of my family, I would have to go through my 10-day minimum of isolation, and then my family's quarantine period would begin after my isolation period is over. So it can be a long time, which is why we really have encouraged people to try and effectively isolate from their family if possible. I recognize that that's not possible in many households, especially many households with multi-generational family members in it. So this is an option to reduce that total duration of quarantine as well. Kimberly, maybe I'll pause there and see if there's any specific questions that have come in about this.
Sure. So we do have some questions that have come in. I think what I would like to do is just review some of our resources that are available to families, and then we'll jump back to this decision tree and jump into the questions.
Okay.
So just for a reference point for all of you, we do have COVID-19 guidance available 7 days a week through our hotline. That's 504-837-7760. That's our school hotline. If you press option 1, you will be routed to a team of nurses that are available 7 days a week to be able to offer a medical guidance on hand, connect you with a virtual visit with a physician, whether that's adult or pediatric. We do have return to school screening, return to work screening, and even enrollment in at-home symptom monitoring if you have tested positive for COVID-19. There's also an ability to schedule for testing in the greater New Orleans area. If you are in the greater New Orleans area, I would encourage you to schedule an appointment with us, and we do have options available for that, that test process, and we can go into more detail about what testing entails. Option 2 on that hotline is 24/7 access to pediatric virtual care. So please keep that in mind. If it's in the middle of the night or if you don't have a primary care physician established, we'd be more than happy to offer some guidance on hand. Please also take a look at our website. We've got all of our town halls recorded, like this one. We also just did a Spanish version of this discussion that will also be posted. We've got flyers and additional opportunities to access our virtual care services and ask questions. So I'll pause there and we can go back and pivot to our decision tree. We did have a couple questions come up, and this was really just about the quarantine period itself. And, so Dr. Finger, if a child has been confirmed as a close contact, how long does that person need to wait until they get tested?
Yeah, so it's a great question. For a close contact who doesn't have symptoms, the best time to get tested is at least on day 5 after the close contact. So if I get sick on Monday and I've been around Kimberly and I can effectively remove myself from her day 1 of quarantine starts on Tuesday. So start counting from the day after your last known close contact. The best days to get tested are days 5 to 7. If you're getting that test as a way to potentially reduce the time spent in quarantine, the best day is on day 7. That will make us the most confident that you are negative and will indeed remain negative, although it's not 100%.
Can you help us understand why, if you're asymptomatic and you're a close contact, you have to wait or should wait 5 to 7 days? From a medical perspective, why is that better?
Sure, because if you're going to catch the disease from that person, it takes 2 to 3 days in order to start developing the disease. So if we test a close contact right away, it almost universally will not be positive.
Okay,
unless they caught it from somebody else.
Okay. So say a student does test positive for COVID-19, do you have to then quarantine for at least 10 days and then get another negative test to go back to school? What's the stance on that?
So it's not quarantining if you're positive, it's isolating.
I apologize, sorry.
So you isolate 10 days, but you do not need a negative test to end the period of isolation. We only follow those 3, it's a symptom and time-based guidelines in order to end the isolation. And again, it's at least 10 days plus symptom improvement plus no fever for the last 24 hours. You're muted, Kimberly.
Sorry about that. Thank you. And can we revisit what it would look like for the entire family unit? I think that families will often get guidance about maybe an adult that gets sick or the student, but what happens to the rest of the family unit?
Yeah, I think it's slightly different when it's a family member who tests positive as opposed to a student in the class about when you might test them. Families who have been around each other, sometimes we will get those tests sooner than the 5 days because presumptively they were around that family member for several days, but it doesn't need to be immediate. There's no sense of urgency to it. It can be several days after the index case has tested positive. And ideally, in the house, are you asking what does it look like if there's a single family member who's isolating? What do they need to do to quarantine?
Yeah, does that mean that person, if there's, means to go be in a hotel for a couple of weeks, or they need to be in a separate bedroom with their own bathroom? I mean, how do you visualize that? Yeah,
ideally when someone's positive, you can really sequester them away from the rest of the family in their own room with their own bathroom and not have them have to come out into common areas of the household. That's not always that's not always possible. So in those cases, what we would recommend is if the person has to leave their own bedroom, that they wear a mask, and that when they do, they really try and maintain 6 feet of distance from the rest of their family for the duration that they're in the common area. And when they're doing that, that the other family members also wear a mask if the kids are able to.
Okay. And say a child or individual has a positive test and then does get another test, or excuse me, I should back up on this question. Can you test out of quarantine? If you have a negative test before your 10-day period is up, can you go back to school or go back to work?
No.
Okay.
So you have to follow the algorithm. You can't test out of quarantine.
Okay, thank you. And then can we elaborate on the different types of tests that are out there, and should families have to pay attention to them, et cetera?
Yeah, it's a great question. Broadly speaking, there are three broad categories of tests. Number one is called molecular, of which a common nomenclature, a PCR test is a type of molecular test, but there's all sorts of molecular tests. Another test is an antigen test, which looks at a piece of the coronavirus that's sticking off. And a third type of test is an antibody test. The antibody test tells us if someone has had a previous infection with COVID-19. It's not utilized to diagnose acute cases of COVID-19. So certainly if someone is symptomatic or they're a close contact, they don't need to get a COVID-19 antibody test. Depending on where you go will depend on what type of testing option is offered. We allow either molecular or antibody tests to be performed on close contacts when they get tested at days 5 to 7. However, for people who are symptomatic and get tested, if the antigen test is negative, they need to get a molecular test done to prove whether or not they have COVID-19. If a molecular test is obtained, that's the standard. At Children's Hospital, when you come on site, we offer that molecular test.
And is there any difference in accuracy between the tests?
Slightly, which is why we recommend that an antigen test on a symptomatic patient, if it's negative, it doesn't count. It's not quite as sensitive to pick up the disease as the molecular tests are.
Okay, and does every single test get administered through a nasal swab, or is there blood work involved, or?
Yeah, the antibody test, which I previously mentioned, which diagnoses or past disease, is a blood test. The tests right now that are available, there's a wide gamut of them. They're either on the tip of your nose, a little bit deeper in your nose, and there's some that are oral, although we're not offering those just yet.
Okay, thanks. Why don't we pivot to some questions just around the disease itself and what transmission looks like. Can you talk about what do we know about the way it's the transmission between children to adults and children to children?
So the vast majority of children who get this acquire it from a household contact. Vast majority. Early on in the pandemic, it was well over 90%. That's a little bit lower now simply because of teenager to teenager transmission that we've seen occur when teens gather out of sight of their parents and out of sight of their teachers and coaches and don't effectively practice social distancing and mask wearing like they're supposed to do. So nevertheless, the vast majority of cases are still transmitted within a household or within close families.
And is that most often from adult to child?
The vast majority, as far as we can determine now, are from adults or older teenagers to the household, as opposed from younger children to older adults. And I think that's different thinking from the very early stages of this pandemic, when we thought that children might be silent carriers. We proved that was not the case. So the vast majority of younger children get this from someone older, not from a classmate.
Okay, thank you. I know in your initial comments also you described what this looks like statewide right now, but can you emphasize again what the overall percentage of total COVID cases are that represent children? Sure.
In the state of Louisiana and essentially nationally, children under the age of 18 make up approximately 11-ish% of cases. We're close to that in Louisiana. There's some states where it's relatively higher, and I suspect that's actually due to the fact that fewer adults are getting tested in those states.
Okay. Okay. And then what are your thoughts around vaccines? How do you feel about them, and what are your thoughts personally?
I was hoping to close with that because that's the awesome good news looking forward to 2021, but I'm happy to answer that now. The data on vaccines is unbelievable. I think my colleagues and I here in New Orleans at Children's Hospital and LCMC are beyond excited about this. Louisiana is slated to get its first shipment next week and will begin vaccination of frontline healthcare workers soon after it arrives. The data is really, really good. I anticipate that over the first 3 to 6 months, we'll be able to continue to ramp up not only healthcare workers, but first-line responders, teachers, essential workers, and then rolling that out to the broader community at large. It's going to make a huge impact in mitigating the spread of this disease. I think we'll be in a different space by April to early summer than we are now. And it's really the silver lining on what has been an incredibly challenging year for so many members of our community. The safety data is really, really good.
Sorry to steal our powerful closer. Maybe we can repeat it at the end just for fun. How about newborn babies and pregnant women? Are there any risks to those people in those conditions?
We have seen a subset of pregnant women aged 16 to 40-ish who get COVID-19. Just like the general public who aren't pregnant, a small proportion of those women can get really ill with this disease. Although it's been reported internationally, we have not seen any cases of vertical transmission, meaning a pregnant mother transmitting the disease to their newborn infant, although it's been reported. We have seen infants in the first several weeks of life present with COVID-19, but they almost certainly have gotten that after birth from an adult family member who is positive, who gave it to them while they were caring for them, either during breastfeeding or bottle feeding or just newborn baby care.
Okay, thank you. Okay, so going back to this decision tree that we have up in front of us, what would you say parents should expect around different types of educational institutions, maybe using the full 14-day quarantine, kind of what we're calling gold standard, compared to what these new CDC announcements are?
Yeah, I think as I've counseled schools about this, I've encouraged them to try and do something that makes operational sense. Again, the going from 14 days seems easier for many schools to do. I know several of them, school districts, including our public school system here, were hesitant to make a change this close to the end of the academic semester, which makes tons of sense. Some of the schools that have made the change have simply gone from the 14 days to the 10 days because they thought it was just simply too challenging to manage understanding what the test results were and making sure that they were accurate and negative. That being said, I think trying to balance the risk with the community at large and understanding that many people weren't actually following the 14 days of quarantine makes a ton of sense. If we can identify any more positive cases between days 5 and 7, that will be helpful because most people have stayed in isolation when they do test positive.
Okay. And just to circle back on how so the variation of quarantine days. So I know there might be that full 14-day, or excuse me, at least 10 to 14-day quarantine period. There could be the 7-day quarantine period. And then there could be a possibility of a 24-day quarantine period if there's a scenario where a parent or another person in the household is sick. Can we review how that could be extended to that long again?
Sure. I think you're asking if there's an individual in a household who tests positive, how could the total? So if I test positive on Monday, I'm able to effectively isolate from my family. I go through my 10 days of isolation and I clear because I'm not sick at all after those 10 days. My children's quarantine period only starts the day after my isolation period is over. So because I've been unable to effectively isolate from them, they are still exposed potentially to the disease throughout my 10 days of isolation. That's why their quarantine only starts the day after my isolation period ends.
Okay. What we'd have a question come in. What if a parent is the close contact? How could a parent look at this decision tree if they are the close contact and allow it to help their own process?
Sure. So they should do what they can to try and socially distance from their family. I know it's not always possible to do that, but there's no 2 degrees of separation. So if I have had a close contact out in the community, my children are not on quarantine. They can continue to do things as normal, but I should make every effort to try and maintain some degree of separation from them within the household during that quarantine period. But there's no 2 degrees of separation for close contacts.
Okay, and then how could families be, transparent with schools and expect the same from schools back, obviously, in the community as well? How could families communicate well with schools around close contacts in the house, what the other members of the family are doing? What does that communication channel look like?
I think we've created, most of the schools have a liaison, whether it's a school nurse or someone in the school principal's office who serves as that primary point of contact. We obviously don't police this. We don't send people out to houses to see how isolation and quarantine is working. We rely on families and communities to be honest. And I think that's the way we've approached this from the beginning.
And then what is a self-certification form that, is posted by the Department of Health? How can that be used by families? I know it's not required by schools, but it's a helpful tool.
Yeah, it's guidance, and we really, 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 really want people to be honest with this. It's, you don't want to look at ways to get around the guidance for quarantine, or to say that I'm not around someone who should be isolating. That doesn't help anybody. And I know that these criteria can be onerous and challenging, but they're really there to keep our children and the rest of our families who might be exposed safe.
And if you use that self-certification form or complete a quarantine period, again, you don't need to have another test that says you're negative, right, to get back onto school campus?
That's completely correct. There is no need to document a negative test to end isolation, for sure. We have had some individual schools who initially wanted to require that test. We can't tell them what to do, but we've had many conversations to explain why that's not necessary, and uses resources that aren't, there aren't tons of, so it uses already scant resources for unnecessary testing.
Okay, thank you. All right, let's pivot to what the holidays look like. What would you advise for traveling or seeing family? How do we do this smart?
Yeah, so I don't want to be the Scrooge, but since you asked, I will be. I think despite the fact that the holidays are coming up, you really need to pretend that everyone outside of your nuclear family has COVID-19. I know we all desire to be with our larger and extended families. Doing that, if you choose to do that, you have to understand that it increases the risk that everyone in that room could get exposed unwittingly to COVID-19. It's a challenge, and I think it's a sacrifice that we all need to choose to make, especially with this upcoming holiday season. We see what we're dealing with just in the post-Thanksgiving time.
And so if there are unique circumstances where a family will choose to take that risk because of a personal situation, would you advise everyone wear masks, stay 6 feet apart? I mean, if it has to happen for whatever personal justification, how would you advise that? What's the next best way to manage the situation?
Yeah, you're sort of like asking me, what's my next best option for putting a baby in a car if people don't want to use a car seat? There's not really another best option, but obviously I would promote gathering outdoors and maintaining 6 feet of social distancing from anyone who's not in your same nuclear family. Okay.
And as say over the holidays, somebody in the family or a student does get sick and test positive for COVID-19, I'm sure every school district has a different policy for this, but would that be something worth communicating to school nurses? Or
it would be, especially if it's in the 2 days after school ends, because close contacts could definitely have been identified in the last day or two of school. So if it's on the last Saturday or Sunday of after school ends on a Friday, I would definitely reach back out to your school leadership to let them know so they could effectively notify students or teachers who might be close contacts.
Okay. So we did have someone submit a specific scenario around having a cousin who tested positive for COVID-19 during the first week of December. And if the family, even if it's a small unit, is planning to get together over Christmas, do you think after 14 days of quarantine, that would still be at risk for transmission?
Well, it wouldn't be at risk for that specific individual, but I still think the potential for someone else or the family that you're going to unwittingly spread it to you exists.
Okay. We've had some other comments come in around how challenging it is for social distancing to take place at school all the time. I know parents can be uncomfortable around the limitations that take place on school campus. What are your thoughts around if social distancing cannot take place exactly at 6 feet in an education?
Yeah, I think it's a great question. And as we started our work with the Department of Education and many other schools way back in the summer, we understood that limitation. Everyone is doing as best as they can, and the promotion of mask wearing at all times, unless someone is eating when they're indoors or they're taking a mask break outdoors, is what we've promoted. I think additionally, what we've done is, rather than trying to find close contacts in those situations, is younger grades especially have been cohorted. So we've just essentially ended up quarantining entire classes. It might be overkill, but it's also better to err on the side of safety rather than to be cavalier about it. So we recognize that that's an issue, although it has not contributed, as far as we have observed, to spread of disease on the school campuses that you're describing.
Okay. And if we have a parent has two siblings that go to the same school, and one of those siblings happens to be in a class that needs to be quarantined because somebody near them tested positive, do you also need to take that other sibling out of school?
No, so and just to repeat the question, there is a third grader and a fifth grader who go to school together. The third grader has a classmate who tests positive, so the entire third grader's class is sent home on quarantine. The answer is no, the fifth grader is allowed to continue to go to school. I would add, if during the third grader's quarantine period, that third grader develops symptoms, I would keep the fifth grader home until we have the third grader evaluated and ideally have a COVID-19 test done on that child.
Okay. Okay, and then some questions have resurfaced around testing. Would you say rapid tests are as effective as other COVID-19 tests? And if this is ambiguous, would you clarify why?
I would absolutely say that we have been able to have a rapid molecular test at Children's Hospital in New Orleans since early April. And the way we approached it was to really limit who was handling those specimens. So I will tell you the tests that we do that are quote unquote rapid molecular are incredibly accurate. We have had, when we have done early on, when we wanted to make sure those were accurate, we compared them to some of the other tests that are send out or take several days to come back. And we had complete synergy in the results, both for positive and negative patients. So I'm incredibly confident in the tests that we administer. There are a lot of places that are offering tests. The vast majority of those are accurate. What I would add is that sometimes if someone gets tested very early on in an illness, I wake up, I have a headache for an hour, and I go and get tested. That test might be negative, but if my symptoms are still persistent at 3, 4, and 5 days, I certainly could have become positive. It's not that that first test is a false negative, is that I didn't have enough virus in my system yet to test positive.
That's helpful. Okay, and I know that we've touched on this a couple of times, but at the risk of being a broken record, how many negative tests are required for a child to return to school? Trick question.
0, 0, 0. Unless it's a close contact who their school is allowing that decreased duration of quarantine to 7 days, at which point a single negative test obtained between days 5 and 7 of the close contact period is necessary.
Okay. And so say you do have an antibody test and it shows that you do have antibodies, could you still get COVID after that or even a second time?
So I see that challenging question from Danielle Taylor. It's a little early with the science to know this. There have been some scattered reports across the world about individuals getting COVID a second time with a slightly different strain of COVID-19 than the first. The vast majority of individuals who have COVID-19 or who develop COVID-19 develop it once, and we have not seen many cases of recurrence of disease.
Okay. I'm going to go back to our symptomatic decision tree. There's questions around trying to understand the difference between allergies and COVID-19 symptoms. So if a child does have allergies, but it looks similar to COVID-19, should you keep them home to be on the safe side, or what should you do?
Yeah, I think that's a great opportunity to dialogue directly with your primary care provider or connect to one of our providers at Children's Hospital through our virtual platform to have that discussion. I hesitate to say there's one blanket statement that covers every kid with allergies, but I will tell you, I've seen lots of kids with runny noses as their only symptom who subsequently test positive for COVID-19. So I think it's something that you really need to have dialogue with your school nurse and primary care provider to really understand what's going on with the child.
Okay. So if a child does have other conditions aside from allergies like asthma or maybe childhood obesity, would you say those individuals are at a higher risk if they did get COVID-19 for complications, et cetera?
So it's a great question, and one that I'll look to our national and international experience for. We think that that's probably the case, but it has not played out in the data that we've been able to share with each other across the world yet. I will tell you, our local experience does not support that. We've seen previously healthy children get severely ill, although as you all know, the vast majority of children who do get COVID-19 exhibit very, very mild symptoms.
And can you review our knowledge around reinfection rates again?
Yeah, reinfection rates, although it's been reported, the vast majority, like well over 99% of people who get COVID-19 have not had another quote unquote episode of COVID-19 weeks to months later. We don't know if this is true immunity or if those individuals have just practiced safe mask wearing and social distancing since their episode of COVID-19.
Okay, and I know we mentioned earlier about how at the beginning of the pandemic, we thought that younger children were these super spreaders and that transmission might have been more prevalent there. But what do you see now in younger children in small, like a preschool setting where they don't wear masks? What do you think about transmission taking place in that age group and the efficacy of keeping a mask on?
It's almost negligible in that age group to spread from kid to kid. I won't say that it can't happen and it hasn't happened, but we've not seen an entire class of preschoolers catch this disease when one of their classmates brings it into the classroom. Again, I won't say that it can't happen, but I think it's completely safe to have those cohorts exist, certainly in their current state. I think most families and educators have been honest and vigilant, and if there's a case at home, kept that other child home when that's the case.
Okay, and what are your thoughts on very young children keeping masks on?
I think if they're able to do it and they're over the age of 2 to do it, but when we laid out our guidelines for the Louisiana Department of Education, we made it mandatory for kids 3rd grade and above and gave some leeway for local leadership to decide what to do. And I think that those decisions are sound.
Okay, and as far as long-term impacts of COVID-19, has there been, well, first, what do we know what the long-term impacts are? And second, is there a difference between children and adults?
Another great question that we still continue to learn about. We have a population of children within the Children's Hospital family who we have followed up for COVID-19. Back in April, we recognized that there's a population of children who got uniquely ill, not necessarily due to COVID-19, but to their body's response to COVID-19. And broadly, that disease is called MIS-C, multisystem inflammatory disease in children due to COVID-19. We followed those patients specifically because there was a concern that they might have some long-term effects. And thus far, we have not identified any children with long-term sequelae secondary to that disease or the COVID-19. And that matches what our peers have found across the country and in Western Europe.
Okay. All right. So I know we're starting to get tight on time here. So do you want to maybe recap some of the high points of what families should keep in mind, especially with students going into the holidays and just in general?
Sure. I think schools and families, by and large, have done an incredible job managing the last academic semester with some stuff that has been really challenging, with learning that's been either in person, virtual, or a hybrid combination. But remember, what we do outside of school impacts the school campuses greatly. So the choices that we make really have repercussions down the line. And everything we do when we gather outside of school can potentially impact the spread of this disease. So I would strongly, strongly encourage to hold on, because hope is around the corner, and to really minimize gatherings as much as you can outside of the school campuses. That's what it's going to take to really help mitigate the spread of this disease.
Okay. And just to hit home again, I know that adopting these new CDC guidelines right before the holidays is something that schools are having a varying response to, correct?
And that's completely appropriate. I think the 14 days is the gold standards. The other ones are options for schools and individuals to take. Okay.
And then can we recap on your thoughts around vaccines again? We did have a specific question come in around whether children are able to get vaccinated or not at all.
Okay. So at this point in time, the vaccines aren't prime time ready for children. Studies are still undergoing. Some of the vaccines in their initial studies included children down to age 16 years, not all of them. The way vaccine studies work is after they're approved for use in adults, or after they approve their safety studies are completed in adults, then they usually continue to extend down to younger age groups, and they're usually grouped kids 12 to 17, groups 8 to 12, and then under age 8. I anticipate that based on the safety profile and the type of vaccines that these are, that the safety profile in children will match what we've seen in adults. And ideally, at some point in early to mid 2021, we'll be able to start rolling those out to children. I can't give you an exact time frame, but I don't think it's going to be years from now before children can get vaccinated. And the day that they can, my 3 girls who are age 7, 9, and 11 will line up at their doctor's office to get it. I'm that confident in the safety profile of what we've seen so far.
So, and then the day that your girls do get vaccinated, would you anticipate them feeling any symptoms or anything the same way that when you get a flu shot, you might feel a little off for a couple of days?
Yeah, great question, especially with these shots that are given in 2 doses spread by either 21 or 28 days. Especially, we've seen that type of side effect profile, especially with the second vaccination, that there can be a 24 to 48 hour period where you can have some side effects. And in addition, this is flu season. So, we have a huge push to get everyone who works at the hospital, 3,000 people vaccinated. And that has contributed to keeping this flu season low. All the regular childhood vaccinations, in addition to the flu vaccine, we should give. Anything we can to mitigate the spread of other diseases will help.
And then I know we've got a couple minutes left. Should families avoid going into clinics or seeing the doctor if they need to, or even having regular checkups because COVID cases are increasing? How should you handle the fear of maybe seeing a doctor right now?
Just like schools, I think doctors' offices and hospitals are one of the safest places on the planet right now. The schools have worked to make their operations safe. Every doctor's office and hospital has uniform mask wearing by all the team members who work there. And I think you'd have to be living under a rock to not know that when you go in somewhere inside, we need to wear a mask when we do that. And that's obviously practiced at every primary care provider's office.
Okay, thank you, Dr. Finger. Do you have any other closing comments before we sign off for the evening?
No, I appreciate it. I hope we were able to get to all the questions in the chat. Kimberly, if you don't, please send us an email and we can respond to you directly. But thank you for everything that you've done to keep your own children and family safe through what has been, what will go down in history as a very, very challenging year. We're ready at Children's Hospital to continue to support you, and I appreciate your time, and I wish you a safe conclusion to the academic year. I know there have been some school nurses and school leadership on the phone as well. So thank you for your leadership and support through this entire year. Very much appreciate it. Have a great day.
Thank you, Dr. Finger. Appreciate you continuing to support everyone and making yourself available. All right, everyone, we're going to call it. I will just reemphasize some of our resources for you. Please don't hesitate to give us a call at 504-837-7760. If you press option 1, you can get on-demand COVID-19 medical guidance. If you press option 2, you have access to 24/7 pediatric virtual care. So we are here to support you. And please also feel free to shoot us an email at thrivekids@lcmchealth.org. If you have any other suggestions or needs, or even the Parenting Center, we're really here to support you, and we appreciate everything that you do. Thank you so much. So everyone have a great holiday, stay safe, and this will be recorded, and we're going to post this on our website very shortly. I will also add that these decision trees that we reviewed today are also available on our website. You can download them there. So I would just go to chinola.org and go to the school and Thrive Kids section, and there'll be some parent resources and the decision tree and recordings. So thanks again, everyone. Have a great night.